I'm Tim Thornton. I was a GP, a family doctor in Rydale for 30 odd years. And my main claim to fame is that my son Eddie is perhaps better known than I am and working hard. I'm going to quickly tell you about my concerns about where the government is with relation to health and fracking. And if I have time, I'd like to tell you about my personal experience of a visit to unconventional gas extraction in Queensland in Australia, which to me was quite a revelation to see from my own eyes and hear with my own ears what I'd read about. For those interested to read up more, Concerned Health Professionals of New York has a fantastic collection of items on health and fracking, as has the Medact report. And I usually end by saying, but I'll do it now, don't trust me, I'm a doctor. So do your own reading and then talk amongst your friends. My belief is that there are significant harms to communities and to public health from fracking, and they are being hidden from public view. Cast your mind back 2014, and our favourite politician David Cameron, in a speech to world leaders in Davos, told of his enthusiasm for fracking. But to restrict the harms, he told us that governments need to reassure people that nothing would go ahead if environmental dangers were present. So I thought, that's it, job over. However, fast forward to 2018, and his pressures to make progress alters the determination that he has. He was talking to oil and gas producers in America, and he spoke of the government's role in trying to deliver fracking. And this is slightly different tone. We passed the laws, changed the planning rules, talked to the companies, changed the regulations, set out the bonuses communities would stand to get if the wells went ahead, but it was painfully slow and incredibly frustrating. The green movements have become absolutely obsessed. So they are just as opposed to fracking, come what may. So congratulations to you all. So how does this affect public health? And under usual circumstances, health is a material consideration. Oh gosh, I've had about 3 minutes free there. Health is a material consideration in a planning application. And what it is, they're trying to say, with the plan that somebody's put in, have an adverse effect on public health? Very simple question. However, in the government advice to councils as to how they must address a planning application for oil and gas, public health is notable by its absence. It cannot be brought into consideration. So my speaking for 15, 20 minutes to North Yorkshire County Council about the planned application for KM8, Kirby Misperton, fell on deaf ears completely. Furthermore, in planning, a central governing principle is the use of sound science responsibly. In other words, let's see what science tells us, look at it carefully, and use it in our deliberations. Greg Clark said it anchors the concept of sustainable development, which is the golden thread running through both plan making and decision taking. Back in the day, Greg Clark was all for localism, local decision making, and sound science. In the latest version of the National Planning Policy Framework, the use of sound science responsibly has been completely removed. We no longer are guided by science, by measurement, or by experience. We now navigate by ambition and reassurance, not by facts, experts, and evidence. Well, does it matter in this instance? Is there any harm or significant risk to public health from fracking? So I'll just have a little dip into some of the papers that I think are best easy to defend, because usually frackers will come back and say, mad professors, or they didn't do a controlled study, or it's not been peer-reviewed, or something like that. They will try and ruin anybody who produces evidence. So senior investigators, professors and the like, Johns Hopkins University School of Public Health in America, probably the best public health school in America, possibly the best public health school in the world. And they looked at large numbers of people, which they can do through their computer access to Pennsylvania records. And they looked at huge populations over the 14 years that the industry has been active at scale in America. Remember, fracking is just like a young teenager. It is 14 years old, 2004-05, when it started to take off. So these professors consider how the impacts varied with the association of the distance from the wells, the number of the wells, and the level of activity of the wells. So they looked to see how the wells affected health. And they found the following associations. The first one was a fairly easy thing for them because all houses measure radon. Households measure radon when they want to sell, part of the regulation of housing. And what they found was that the level of radon in the houses related to the number of wells, the distance, and the activity of the wells. Because when the wells are being drilled, and when they're doing the actual fracking, is when there's most release of gases of one sort or another. So when they measured them, there were 300,000 houses over the national recommended maximum for health. And radon is the second most common cause of lung cancer. So that matters. But we haven't seen a rise in lung cancer. But you know perfectly well, you will know people who stopped smoking when they were 40, and at the age of 60, 65, they got their lung cancer. There's a delay. Next, and this is where my red lines come into play. This is where I think there's no question that we should resort to the precautionary principle. Pregnancies were affected. And what they found was an increase in premature delivery of more than 3 weeks, increased by more than 40%, 40%, for those mothers most exposed compared to those least exposed. And those mothers also experienced a 30% increase in complicated pregnancies identified by their doctor. So there we have it. More than 3 weeks premature, and some of them considerably more premature. I worked on a special care baby for just over a year, and so I know what the issues are with prem babies. They may be perfectly all right, but I know also the illnesses that they go through, the cost, the outcomes of those illnesses that they may have, and some don't make it. And to me, it's unconscionable that we could do anything within 2 miles of our pregnant daughters and daughters-in-law. Asthma increased, requiring hospitalization and the use of steroids. It increased by 1.5 to 4 times, depending on which subgroup you looked at. I always thought that asthma requiring steroids in hospital was a failure in my care. And this is going to increase it by 1.5 to 4 times in terms of admission rates and so on. And then they looked at symptoms, because there's a sort of a natural gas symptomatology. If you expose people to natural gas, there are lots of people who get headaches, they get migraine, they get nasal congestion, they get sinusitis, they get sleepiness, they get confusion and incoordination, wobbling about the place. Children in particular get rashes, and they get intense itching of their hands and their feet, sufficient to keep them awake. And children in particular get nosebleeds. Not like one a week, they get several every day and at night. And for families, this is a real problem. And what they found, what they could define, were symptoms of migraine, nausea, and sleepiness increased in association, as I said, to those exposures to the wells. A lot of those things won't get recorded. When you go to the GP, we tend to scribble down all sorts. It can't be read. And it's not everything that you get is coded in to be recovered later. So these are the things that could be easily drawn down from the records. Levels of depression were raised depending on exposure to the wells. And Waiting in the Wings is another paper which will be out in the next weeks or months, showing that heart failure depends around the wells according to the number of wells, the distance from the wells, and the activity of the wells. So a different group, using again large sets of data from Pennsylvania, looked at 3 counties in Pennsylvania, two of which, had a large rollout of fracking, and the third one, because it was a water source area, had no fracking. And they checked the people and the population and the ages and the smoking and everything else was very similar. And what they found was that in the fracking counties, there was a 27% increase in the hospital admissions for heart and neurological problems compared to the one with no fracking. And if you know what your local hospital is like, I doubt that they could cope with 7% increase in heart attacks and strokes, and I don't think you'd want it for your families either. And lots of studies have looked at tightening the regulations. How could we tighten the regulations and get excellence in engineering? It will sort all these problems out. But when they've looked into it, one for instance in California, they found that despite those interventions, it would not be possible to reduce important harms to a level below significant and inevitable. You can't make bad stuff go away. So you look at the raft of studies on public health and its impacts, and you find significant harms reported or high levels of risk in over 80% of the studies that have been taking place. We, as health professionals or scientists, are steered away from looking at or considering the harms in other countries and from learning from their mistakes and the damage. If I talk about these things to the councils or wherever, completely discounted, yes, but those are not English studies. If we are so blinkered, how will we know if fracking is safe in the United Kingdom under our regulations, our geology, and our population mix? Well, there is no plan to examine the public health impacts of fracking in the UK. We are not measuring the likely health variables, as we've seen in America, Australia, and wherever, before fracking gets underway. And there is no specific collection of data that might be helpful to determine, is fracking safe? We are simply left with government reassurances. No facts, no science. We cannot count the bodies. Sorry, I jumped a sentence. All we can do is count the bodies. And this is what I told North Yorkshire, because their assessment of the impact of public health was all about increased death rates and increased cancer rates. Well, it's too late by then. People living in the gas field complain of being guinea pigs. Without the science, I fear they're more like sacrificial lambs. I think I've overstayed my welcome so far.